Good afternoon, everyone. It's Jeremy Benamy here in my basement in Washington, D.C., and so pleased to be joined by Congresswoman Deb Haaland of New Mexico, a dear friend of J Street's, and I know a hero to many of the people in J Street who have such admiration for you and the work that you do and what you stand for. We are doing a little bit of a detour away from our focus over the course of the past few weeks on the J Stream on Israeli-Palestinian issues and on issues related to the Middle East and foreign policy to take a focus here at home on some of the issues that are really not perhaps getting as much attention as they should as we think about this incredible epidemic and crisis. And we've had a few conversations. I've been really pleased, for instance, with your colleague, Representative Judy Chu. We talked a bit about some of the issues of discrimination and racism that have come up against Asian Americans as a result of this. So I'm glad we have the opportunity to talk to you a little bit today about the impact of this crisis on Native American communities, which have been especially hard hit by the COVID-19 crisis and the response of the federal government, which is largely neglecting the needs of the community. I look forward to hearing more about that. And I think people probably don't know that after New York and New Jersey, the Navajo Nation has the third highest rate of COVID-19 infections in the United States. This is all, of course, grounded in pre-existing inequalities and things like food insecurity, insufficient healthcare, lack of basic resources. These are all built into the system, and they lead to outcomes like this when you have a national crisis that then ends up affecting those who already started out behind. Congresswoman Deb Haaland is one of the first Native American women elected to Congress. She's a co-chair of the Congressional Native American Caucus. She's leading the charge to ensure that tribal communities receive the support they need and the attention they deserve in this fight against the pandemic. And it is such a pleasure for me to welcome you to this webinar. And I know that folks are really anxious to hear a little bit about your perspective. But let me ask you first, how are you doing? How are you personally and your family doing?
We are all well, Jeremy. Thank you so much. My mom, I haven't been able to see in person. I can only visit her through a window. We get on our phones and look at each other through the window. But I am following all the instructions for this pandemic, and I want to be part of the solution. So I can't wait till we can all see each other in person and give real hugs instead of virtual hugs.
As do I, and it will be a great moment. And so, well, without any further ado, then let me turn it over to you to perhaps give us a little bit of a picture, a window into what is happening in the tribal community and Native American community, and how this epidemic has been affecting the community.
Well, thank you again so much for inviting me here today. It's always an honor to be introduced by Jeremy. I've enjoyed getting to know him during my time in Congress, and I'm so grateful to J Street for all of the leadership in helping all of us members of Congress to better understand everything that is happening in the Middle East. I was so lucky to travel with J Street last fall to Israel, and it was a very instructional and eye-opening trip. And it has stayed with me for that long. So it was wonderful. I really appreciate the coalition building efforts that J Street does so that we can all learn from each other's experiences and needs. I'm a member of the Pueblo of Laguna, which is here in New Mexico. It's about 40 miles west of Albuquerque. It's not in my immediate district, and so my mom can't vote for me, but nonetheless, I'm a proud member of Laguna Pueblo. And as Jeremy mentioned, one of the first two Native women in Congress. I co-chair the Congressional Native American Caucus with Representative Tom Cole, who is a member of the Chickasaw Nation. I'm proud to be speaking here today to help shed some light on the issues that are taking place in Indian country right now during this pandemic, since our voices have historically been left out of the conversation when it comes to national issues. I welcome everyone that is interested in uplifting the voices of tribal communities to partner with my office or the Native American Caucus to help us to address the racial and economic disparities that we've seen across the board in all of our tribal communities, and not just throughout the pandemic, but always. This week, the state of New Mexico published statistics showing that 55% of the statewide coronavirus cases are Native American, even though the state population of Native Americans is only 11%. That's over half of the state's cases, which is obviously disproportionately impacting tribal communities more dramatically than other groups of people. And as Jeremy stated, if a state, the Navajo Nation would be third in the country for the number of cases. Native nations have historically been neglected by the federal government. The federal government has not lived up to its trust responsibility to Indian tribes. Tribes have lacked federal funding that was promised to tribal governments as part of treaties, acts of Congress, executive orders that the United States agreed to with tribal leaders for the loss of millions and millions and millions of acres of land, and of course, the genocide that Indigenous people endured from the time the Europeans got here. I've been working hard with my colleagues to help bring a voice to tribal communities, especially to address the chronic underfunding in Indian country that's become more apparent than ever during this COVID-19 pandemic. As you may have heard, I've been working with Senator Warren on an upcoming bill called the Honoring Promises to Native Nations Act. This will be a comprehensive bill that closely follows the U.S. Commission on Civil Rights Broken Promises report to help shed light on the lack of funding across all federal agencies that impact Native American housing, education, healthcare, public safety, and economic development. This bill is significant because it aims to reaffirm the federal government's trust responsibility. Federal funding is also needed to combat the silent crisis of missing and murdered Indigenous women, which can be helped by fully funding public safety in Indian country. And missing and murdered Indigenous women is an issue that I have made one of my priorities since I've been in Congress. As part of my commitment to highlight this silent crisis, I introduced a resolution earlier this week with my sister, Representative Sharice Davids from Kansas, who is an enrolled member of the Ho-Chunk Nation. This resolution is important because it calls for May 5th to be designated as a National Day of Awareness for missing and murdered Indigenous women and girls, so Indigenous voices can be lifted into a national conversation where we haven't traditionally been heard. In an effort to further bolster the voices of Native Americans today, I also introduced the COVID-19 Disaster in Indian Country Act, which is an unprecedented bill that directs the Federal Communications Commission to designate emergency spectrum authority to tribes for the first time so they can deploy broadband services on their tribal lands. This is especially important when the coronavirus has forced everyone to use telehealth services, digital connection for employment and education, and basic access to life-saving services. I'm fighting hard to include this language into the next stimulus package so tribes don't get left even farther behind in the digital divide. Tribes have faced substantial barriers to accessing their spectrum rights over their tribal lands, preventing them from building wireless networks. This has left about 1.5 million Native Americans living on reservations without broadband or telephone services. Even though only 8% of Americans lack access to broadband services, only 65% of American Indians and Alaska Native households on tribal lands have access to broadband. The Bureau of Indian Education also recently estimated that up to 95% of their students don't have access to broadband at their homes, which is completely unacceptable, especially as our society becomes more digitized. Not only have tribes been hindered during this pandemic by a lack of access to their spectrum over tribal lands, but the Trump administration has held up the distribution of $8 billion of coronavirus relief funds to tribal governments who desperately need this funding because they include corporations as eligible entities to apply. And so this took time to sort it all out. I think tribes are starting to get the money now, but it took way too long in the first place. Further, to make matters worse, tribes across the country, including my own Pueblo in New Mexico, still haven't had adequate tribal consultation from the CDC or even been provided with the CDC's community mitigation teams or epidemiology analysis that have been provided to states or territories. Tribes are sovereign governments, but have continued to be left behind, especially when it comes to diseases in the history of America. The Trump administration's blatant disregard for Native lives is palpable. It's far past time that we hold them accountable. For communities that lack access to basic luxuries like running water, electricity, and internet and phone services, the administration has completely failed their responsibility to tribal governments, and it's clear they couldn't care less and are now refusing to provide federal economic relief funds and public health funding from the CDC. The CDC is scheduled to finally disperse their first round of funding to the Pueblos at the end of June, even though the rates of infection are 55% in my state. Indian country has had enough historical trauma, and I hope all of us can come together to bring a bigger voice to these injustices that our communities face. And so I'm happy that we're all here today to have a conversation about this and perhaps learn how we can help one another in our fight for justice. Thank you, Jeremy.
Thank you so much, Congresswoman. And the picture that you paint is, both one that is shocking but not surprising. I think we know that this epidemic has exposed the disparities and the communities that have been underserved and have these structural issues. And I'm wondering if you could just outline, it's probably information you know off the top of your head, but many of the people in J Street don't know, which are some of the basic health challenges that the Native community faces as a whole, that are the types of challenges that actually make them more vulnerable in a moment like this. And perhaps some statistics or just a picture of that would be helpful.
Sure. I'm not good on statistics, but look, I can tell you that the Indian Health Service was created to address these issues in Indian country. You might know that a lot of tribal lands have old mining sites, and for decades and decades, the U.S. government has leased land in Indian country to make money. And I think, there at last count, there were over 1,000 abandoned mines on the Navajo Nation, mines where the land has not been reclaimed. That means that dangerous chemicals seep into the water. And so a lot of people on the Navajo Nation, for example, which is the site of the highest number of cases, I think in any Native community, their water's polluted, so they're unable to use it. There are places in Indian country with no running water at all, no electricity, and as I mentioned, no broadband. Also, some of these places have food deserts, so it's difficult a lot of times to get fresh vegetables and fruits. And so as a result of all of these combined, Native Americans have one of the highest rates of diabetes in the entire country, for example. And they have talked about diabetes being an underlying medical issue that exacerbates the symptoms and the problems with COVID-19. So these are just some of the issues. I really feel like the broadband issue is really a large issue for Indian country, and it just prevents people from connecting, from having an opportunity to get the help they need. And when we think about it on a health scale, it's devastating, but it's also devastating during this COVID-19 virus for folks who are trying to make a living, right? In some areas of Indian country, the unemployment rate can get past 50%. And so tribal folks take matters into their own hands. They They make their arts and crafts. They make jewelry. They do their art, and they sell it in various places. And right now, with self-isolation and social distancing, that's been a difficult thing. Imagine if if tribes had had internet for a long time and they were able to sell their art online, for example, they'd be in a much better place than they are today. So there's a lot of issues that just pile on top of one another, and that's kind of the situation.
And I'd imagine also that the broadband issue probably ties into educational issues, that the kids are unable, if they aren't able to attend school and then they don't have the broadband, it's very hard to do the distance learning that so many of us, you know, my kids are upstairs doing that right now, and we're so fortunate, and it's really a problem in communities that don't have that.
Exactly. Yes, absolutely. And I know that, I mean, school got out, and kids have been home. And so, yes, they face a disadvantage that way. And Jeremy, I should mention one other thing too, that I'm thinking about it. Respiratory issues. This, the COVID-19 virus, it's a respiratory disease. And in the northwest corner of New Mexico, the largest methane cloud hovering above our state, because the gas and oil industry refuses to clean up their mess, basically. And so you have all this air pollution that gives kids asthma, and adults too. We are getting it from all sides. Our communities have been ripe for this pandemic ravaging our communities. And we've been fighting with the gas and oil industry for a long time. They can easily stop all this pollution. They choose not to. And so these are all issues that add on to the severity of the COVID-19 virus.
I heard you mention the issue of the $8 billion. I had noticed that there was a specific set aside in the CARES Act of $8 billion for tribal assistance, but it apparently, you were saying, it has not yet been actually delivered. What's the story with that? Because there was an effort to provide some targeted money.
The $8 billion?
Yeah.
You said, yeah. So I think it's starting to be, I talked to someone from the Cherokee Nation yesterday, and they had gotten their funding. I understand the Navajo Nation may have gotten theirs as well. The Treasury, what happened was the Treasury took far too long to do their formula. In fact, last week, Chairman Ruben Gallego and we had to write a letter to the Treasury asking them to make this, make it a priority. They needed to do a formula so they could start dispersing the money. Although not all the money, only some of it, because there was a lawsuit filed against the administration because the $8 billion was to go to federally recognized tribes, of which there's 574 in our country. And the Trump administration had essentially, they just didn't do it right. They were going to allow corporations to apply for that particular funding. And so there was a little bit of a fight, a court case, and that held things up as well.
So I've got a couple of questions that are being fed into our chat that also were questions I was going to ask. One of them, not meaning to make this political, but everything in life is political, in my view. What do you think a Biden administration, and what has the Biden campaign said on specific issues of concern to you and to the Native community? I mean, do you have a feeling that there really is an agenda and an understanding that would be different, and are they vocalizing it to your satisfaction?
Thank you for that question. First, let me say that the Obama administration was the best administration for Indian tribes. If you remember, President Obama held tribal nation summits every single year. He promised tribal consultation. He promised to talk to Indian tribes directly, and he did just that. Tribes went every December to Washington, D.C. and partook in this tribal nation summit. And it wasn't just the president, it was all the agencies, all the departments, department secretaries got together, and tribes were able to converse with them directly. Likewise, the Obama administration moved more land into trust for Indian tribes than any other administration had ever done. Settled 2 large class action lawsuits, the Cobell case, which had to do with tribal trust monies, and also the Speak-Seagull farming class action lawsuit that that settled, money for Native farmers. And so the Obama administration lived up to all of its promises to Indian country. Vice President Biden was a part of that administration. Just the other day when we had the National Awareness Day for Missing and Murdered Indigenous Women and Girls, Vice President Biden put out a statement that said his top priority would be to pass the Violence Against Women Act as soon as he gets into office. I know that Vice President Biden will pay attention. He has experience already with moving tribal issues forward. He cares about Indian people, and I have every faith in a Biden administration that it will take these matters seriously and work to move them forward. So I can say that Vice President Biden already has high marks in my book for the work that him and President Obama have already done for Indian tribes.
Terrific. And I think, as you know, for J Street, the changing the occupant of 1600 Pennsylvania Avenue is our #1 priority. And it's not just on the issues we work on, of course, it's on the issues of concern to all of us. So we're actively behind that. Another question that is coming up from people watching, but that I wanted to ask you is, what is an avenue for individual citizens who want to be providing assistance and help to Native communities? I mean, what would be the best route for people to plug in on an individual basis?
Jeremy, there are a number of organizations, and I'm sorry, I had Janine Yazzie on one of my Facebook Lives the other day, and I'm sorry I don't remember the exact name of her organization, but there are a number of organizations who are doing amazing work, delivering food boxes directly to families of these areas that have been ravaged by this virus, people who are unable to work and don't have transportation, and like all of these other issues. So I will get those for you, and perhaps you can post them on your Facebook page. But there's also the Pueblo Relief Fund that the All Pueblo Council of Governors is doing. And there's a number of Navajo organizations, but the nonprofit organizations who have stepped up to help Indian country, not just here in New Mexico, but across the country, have been amazing. And while we're at it, everybody needs to answer the census. That is going to be the most important thing. If you work with Native folks anywhere, remind them to answer the census. Remind them to remind their families back home to answer the census. This answering the census will also help us to move these issues forward into the future. It's so important.
I saw that comment come up in the chat. I'm really glad that you addressed it. Another one that's coming up in the Q&A side of the chat is about voting by mail and the question of how that impacts and potentially could be challenging for those in Indian country. So just curious These are all issues that relate to the strange environment that we're now operating in and the lack of mobility. But what is the situation with vote by mail in New Mexico and in Indian country?
So in New Mexico, the Secretary of State filed a petition to try to get everyone a ballot sent to them. The Supreme Court made a decision that it wasn't in the Constitution. So they said you can send an absentee ballot request form to everyone, but you can't send a ballot. So at this point, we're working hard to make sure that everybody will fill out their absentee ballot request form. You can also request a ballot online, but the Secretary of State did send it in the mail. Postage paid, you can return that request form and you don't have to find a stamp or buy a stamp, because I know that's a pain sometimes. And so we're hoping, we have a huge, I partnered with the Democratic Party of New Mexico to really get out some messaging on this issue, because we really need everyone to vote. This is the most important election of our lifetime. And it's important in the primary. Generally, when we have a lot of voters come out in New Mexico in the primary, that means we're going to have a really good general election turnout as well. So we're pulling out all the stops and working our hearts out to make sure that everybody votes. And yes, that absolutely is the most important thing this year too. Yes.
It is amazing how these basic civic steps, answering the census, making sure one can vote, if there's a single set of acts that will help us to address the very problems we're addressing, it's these basic civic steps that we need to make sure are available and then taken advantage of by everybody across the board. Aaron Levin asks a question about the Indian Health Service and whether or not, in your view, it has the resources that it needs in terms of both finances, but also human resources to cope with the pandemic on the Navajo reservation. And are there other reservations that have been hit as hard as the Navajo reservation?
I think the Navajo Nation might be the first, and it's the largest, and it's really spread out, and that's, it's hard to get to everyone. Some people might have to drive 80 miles just to get to a clinic or a hospital. So those are, those add on to the challenges. The Indian Health Service, as I mentioned in my introduction, the Broken Promises report that the U.S. Commission on Civil Rights came out with, and it was last December when they published it. Healthcare was one of the areas where they fell behind. And the Indian Health Service, yes, it's been underfunded for a long time. I'll add that the Affordable Care Act helped the Indian Health Service a tremendous amount, because in the states where Medicaid was expanded, like New Mexico, Native folks could apply for Medicaid, and then they could go to use one of the Indian Health Service clinics or hospitals, and the clinic or hospital was able to third-party bill for those services. So the Affordable Care Act really helped the Indian Health Service a lot. And of course, the Trump administration, they've done nothing but try to get rid of it. So that's always been a challenge since Trump has been in office. Nonetheless, the Indian Health Service is behind. They're behind with their technology. And so imagine if they were up to par with their technology, they'd be able to do a much better job. And Rear Admiral Michael Wiaki is doing the best job that he can possibly do. And he's working his heart out to make sure that Indian country has what it needs. We need to make sure that he has what he needs to make this service viable. And I feel like this pandemic, Jeremy, it's just laid bare all of the disparities in our country, not just with tribes, but with communities of color all over the place. African Americans have the highest rate of infection in a lot of our urban centers, and so it's our job as a country to build these communities up, and if we don't take action now, after it's in black and white in front of our very eyes, then it's a shame. But look, that's why I'm going to work my heart out to win this next election.
Absolutely. That is the biggest message out of this whole epidemic, is the underlying structural inequalities that have not been addressed and that then play out in disastrous ways when a challenge confronts the country as a whole. There's a couple of people who have very specific questions that are geared at New Mexico or at specifically the indigenous, urban indigenous population in Albuquerque, which was very interesting. The question says that Albuquerque health agencies have started doing COVID testing for any urban indigenous person in the city, even asymptomatic, and it's the first targeted testing for this population in New Mexico. And the questioner, Sean Griswold, is curious, is it important why is it important to test this particular urban Native population?
Well, I'll say, we need to test, period, right? All over the place. Right. For urban Indian populations, look, a lot of folks who use the urban Indian health centers, and we have a wonderful one here in Albuquerque, and I know they're across the country. A lot of cities have them, and they're good, and they're accessible to people. But the one we have here, the name slips my mind. Why it's important to test urban Indians is because they might come here to work during the week, and then they go home on the weekends. They go home to their tribal communities to see their families, or they might have they might have a home in their home communities. And we don't want them taking the virus back. That's what's been happening. So we would, the urban Indian health centers are good. They're accessible. They can, they work extremely hard. And yes, that's why they need to be supported as well. And and with this next bill, we're fighting for funding for those entities so they can keep their doors open. Right.
One of the folks in the chat here is asking about, in terms of naming some specific organizations that are really doing good work, is mentioning the Southwest Reservation Aid. I don't know the organization myself. I don't know if that's one that you might recommend, but it's mentioned in our chat. So I'm curious if you happen to know that organization, Southwest Reservation Aid.
I don't know that one, but we'll absolutely look it up.
Terrific. Well, we are, a couple minutes away from the end of our conversation, and I sort of want to give you a chance to give some closing thoughts here. In particular, I think for us in the Jewish community, we are always looking for ways to be of support. Is there a way for us to show our support for other communities that endure discrimination and that are at the receiving end of some of the worst of this? And I just want, to hear from you whether there's anything particularly that we can do to partner on a communal level, an organizational level, and maybe some final thoughts about where we're at.
Well, if everyone, look, we're consistently messaging about these issues. So we're on Twitter, we're on Facebook, we're on Instagram. I have my campaign accounts, and I also have my official account. You can go to my social media and retweet, repost, comment, move our issues forward. Our emergency broadband bill that we're fighting for, we might have sent a press release out about that. And all of, the things we're working on are on my official website. So we would just be really proud to have all of you help us with moving messaging forward. And I would say also, the National Congress of American Indians has been a voice for, it's a large contingent of tribes. The National Congress of American Indians has worked very hard on all of the things that I've just talked about, and they're found at ncai.org. And you could probably go there also, and they would essentially tell you how you can help. And so we'll make sure, Jeremy, that you get all of these websites that I didn't know to tell you right now. But we just appreciate it. I'm honored to be here with you, Jeremy, and honored to have the relationship that we do with J Street, because I know you're always going to be there for underrepresented communities, no matter where they are. If we all work together, I know we can move our country forward. We can fight this pandemic. We can make sure that people, that they have what they need to be successful in this country. You know, sometimes I get so sad about, I feel like things haven't changed enough, that we haven't embraced our communities of color enough. The recent shooting of the African-American young man, back in February, and they just barely arrested somebody. Those things, they get me down. But we have to keep fighting, and we have to keep speaking out and moving these issues forward. So I appreciate you as a partner and everyone on this chat today. Thank you for being here, for listening, and for caring.
Thank you. You've been such a partner for us in the issues that we care about. You've taken a really extraordinary interest in the issues that are of concern to J Street at our core, and we want to show that partnership to you and ensure you that we are interested in the issues of central importance to you. So we want to be here for you as you've been there for us, and it really is a partnership. It's tremendous to have you in Congress. It's tremendous to have you as an ally, and I look forward to continuing to work with you.
Thank you.
All right, thanks everybody. We look forward to seeing you on our next JStream events.
Bye-bye.
Bye-bye.